So yeah, I'll be asking the next question, the next pharmacology possible examination question, and this is what the clinical uses of what eicosanoid receptor antagonist. Earlier we made a video on substances that will basically block the synthesis of eicosanoids. I will discuss eicosanoids to say that they are basically chemicals in the body that mediate what immunity and inflammation and all those platelet aggregation. Okay, and sometimes since they mediate these sensitive reactions, their actions can go out of hand. Okay, so you want to actually like control them. So another method of controlling them is basically you using drugs or substances that can attack them at the receptor level. Okay, that's what they call them. They are receptor antagonists. Okay, so be looking at the various clinical uses, right? Maybe like various clinical like medical conditions that we can be able to actually use this substance to actually manage in the hospital. So the examination question was asked like this. Discuss briefly with suitable examples the clinical uses of what eicosanoid receptor antagonists. Okay, eicosanoid receptor antagonists. Um, okay, yeah. Prostaglandin is a type of eicosanoids. We have the leukotrienes and we have the what prostacyclins. Okay, we have the thrombosane H2. All right, so eicosanoid receptor antagonists have various clinical uses, and their clinical uses include what? They can be used for what? Inflammatory disorders, right? So they are used to treat inflammatory disorders such as what? Asthma, inflammatory bowel disease, and rheumatoid arthritis, okay? And they act by blocking the action of what? Pro-inflammatory eicosanoids, such as what? Prostaglandins and leukotrienes. If these eicosanoids are there, they will promote inflammation, all right? So these substances will now what? Block the action of these what eicosanoids, right? Maybe by blocking their receptors. Then they can be used in cardiovascular diseases too. So they are used to treat cardiovascular diseases such as what atherosclerosis, hypertension, thrombosis by blocking the action of what eicosanoids such as what thrombosane A2 and what leukotrienes. And these eicosanoids, that's thrombosane A2 and leukotrienes, when they are there, they'll basically promote platelet aggregation and vasoconstriction. All right, so these drugs now block their receptors, thereby what reversing their action. All right, so this is leukotrienes, the different types of leukotrienes, right, which is an eicosanoid too. They can be used for cancer treatment. We say that it can be used to treat cancer by blocking the action of what eicosanoids such like what prostaglandins and leukotrienes, which promote tumor growth and metastasis. All right, then they can be used for pain management too. They are used to manage pain by blocking the action of eicosanoids such as what prostaglandins, which are involved in what pain perception. All right, then they can be used for resolving of inflammation. I think this is why I brought this question, picture here. You see resolvins. Okay, we'll talk about it. For immune response, they are used to modulate the immune response by blocking the action of what eicosanoids such as what leukotrienes, which are involved in what immune cell recruitment and activation. Okay, they're resolving inflammation. They are used to promote the resolution of what inflammation by blocking the action of what pro-inflammatory what eicosanoids. Okay, and promoting the action of what anti-inflammatory what eicosanoids such as what resolvins and marasins. Right, so basically we have eicosanoids that are what promoting inflammation, and we have eicosanoids that are not promoting inflammation. All right, so when you inhibit the ones that are promoting inflammation and you activate the ones that are against inflammation, and you know that the inflammation will be what resolved. Okay, that's why we say that resolving inflammation. Okay, so guys, that's it about the various clinical uses of what eicosanoid receptor blockers. All right, see you guys pretty soon.